All right, let's jump right in. We're talking about one of the most common surgical emergencies out there, acute appendicitis. It can start as just a little ache, but it can get serious, fast. So today, we're going to be medical detectives, demystifying this whole thing by following the clues from that very first symptom all the way to the final diagnosis.
I mean, we've all had it, right? That sudden, weird pain in your gut. Your first thought is probably, ugh, must have been something I ate. But what if it isn't? When does that simple bellyache cross the line into something you really need to worry about? That's the big question we're trying to answer.
Okay, so every good investigation starts with the first clues. And for appendicitis, it's all about recognizing a very specific set of symptoms that tell a classic, almost textbook story.
So what are we even dealing with here? Well, the appendix is this little finger-shaped pouch that just kind of hangs off your large intestine. And for reasons we're still trying to fully understand, it can get seriously angry, inflamed, and infected. And boom, that's what we call acute appendicitis.
Now this is where the story gets really specific. We're not talking about just any old stomachache. The classic sign, the thing doctors are really listening for, is a pain that starts kind of vaguely around your belly button, and then, over a few hours, it actually moves down and to the right. That migration is a huge red flag, especially when you also completely lose your appetite. I mean, you wouldn't even want your favorite food, and maybe you feel nauseous and have a bit of a fever. That's the classic picture.
So now the doctor has a prime suspect. But, good detective work means you can't get tunnel vision. You have to rule out the other possibilities. You got to think of the lower right side of your stomach as a busy neighborhood. There's a lot of other stuff going on there that can pretend to be appendicitis.
The investigation gets hands-on pretty quick. A doctor will gently press on your abdomen, and they're hunting for one very specific spot. It's about 2/3 of the way from your belly button to your hip bone on the right side. It's called McBurney's point. And if you basically jump off the table when they press there, well, that is a huge physical clue pointing directly at an angry appendix.
But a good detective can't stop there. You gotta line up all the other suspects. The pain could be from swollen lymph nodes, a UTI. Heck, sometimes even pneumonia in the bottom of your right lung can feel like this. For women, you also have to consider things like ovarian cysts. So, telling the real culprit apart from all these lookalikes, that is the true challenge of the diagnosis.
With a list of suspects, a physical exam isn't enough. It is time to bring in the forensics team. We're talking about lab work and advanced imaging to gather the hard evidence needed to crack the case.
And this whole process is super methodical for one very important reason. You want to be absolutely sure before considering surgery. So you start with the patient's story and the exam. Then you move on to blood and urine tests to look for infection. And only then, when the suspicion is really strong, do you use imaging to get an actual picture of what's going on inside. So what are these tests telling us? Well, think of your white blood cells as your body's own little army. When their numbers go way up, it means they've been deployed to fight an infection. Then there's this other marker, C-reactive protein, or CRP. When that's high, it's like a system-wide alarm bell for inflammation. You put those two clues together, and the case for appendicitis gets a whole lot stronger. Okay, this part is actually fascinating. The choice of which imaging tool to use isn't one size fits all. For kids or thinner adults, an ultrasound is usually the first pick. It works great and there's no radiation. For most adults, though, a CT scan gives you the clearest, most detailed picture. But what if the patient is pregnant? That's when you use an MRI to get that crucial image while keeping the baby perfectly safe from radiation. It's a perfect example of personalized medicine in action.
The evidence is in. The diagnosis is confirmed. It is, in fact, acute appendicitis. Now, a huge decision has to be made on what to do next, and believe it or not, the options might surprise you.
For decades, there was only one answer, an appendicectomy. You go to surgery, you take the appendix out. End of story. And that is absolutely still the gold standard. But for some very specific, uncomplicated cases in adults, there's a growing amount of evidence for trying an antibiotics-only approach first. It's a non-operative path that takes a really careful conversation between the doctor and the patient.
But here's a twist in the story. What happens if the body has already tried to deal with the problem on its own? Sometimes the infection gets walled off by other tissues before you even get to the hospital, and that creates complications that need a whole different strategy.
It really all depends on how the body tried to contain the infection. If it forms something called a phlegmon, which is basically a solid, inflamed clump of tissue without a lot of liquid pus, the plan is often to just hit it hard with IV fluids and antibiotics. But if it's turned into an abscess, which is a walled-off pocket of actual pus, That usually needs to be drained with a needle plus antibiotics.
So, the appendix is out, or the infection has been treated. Case closed, right? Well, not quite. Like any big medical event, the road to recovery can have a few potential turns, and it's always good to know the map ahead of time.
Now look, most people recover without a single problem, but it helps to know what's possible. It can be anything from a simple infection at the incision site to a more serious abscess deep inside. Sometimes the bowel just slows down for a bit, which is called an ileus. And down the line, internal scar tissue can form. Knowing about these things is just key to a smooth and informed recovery.
And there you have it. From what seems like a simple bellyache all the way to a complex medical investigation with physical clues, lab work, and high-tech imaging. It's an amazing reminder that sometimes the smallest, most ignored parts of our body can cause the absolute biggest problems. It makes you wonder, doesn't it? What other tiny part of us holds that kind of dramatic potential?